Pennsylvanians who have tested positive in all 67 counties. Approximately 1,558 of our total cases are now in healthcare workers. Tragically, we now have 836 deaths among those who have tested positive for COVID-19 in Pennsylvania. And to date, all of those deaths have been in adult patients. As of 10 a.m. today, hospitals are reporting that approximately 2,601 patients are currently hospitalized due to COVID-19. This is about 8% of our total case count. 639 of those hospitalized have required the use of ventilators or breathing machines. Across our healthcare system, approximately 48% of hospital beds, 41% of intensive care unit beds, and more than 70% of our ventilators are still available. We know that testing is critical to our efforts to determine how many Pennsylvanians have COVID-19. And we know, as I've stated before, that our daily data is an undercount of our positivity rate. We have been working over the last week and a half to set up a public testing site for residents in northeastern Pennsylvania because, as we have discussed, we continue to see increases in case counts there. We have worked with the community, local elected officials, as well as state and federal legislators to finalize the details of this public testing site. Beginning Monday, we will offer drive-through testing at the Mohegan Sun Arena at Casey Plaza in Wilkesboro, Luzerne County for 100 first responders and healthcare workers who live or work in northeastern Pennsylvania and are having COVID-19 symptoms. Now, this will be in the parking lot of the Mohegan Sun Arena. After Monday, we will expand testing to first responders and healthcare workers who live or work in northeast Pennsylvania and are having COVID-19 symptoms, as well as Pennsylvanians over the age of 65 who are having symptoms consistent with COVID-19. We will be able to test 200 people a day, and pre-registration is required. To be tested at this site, you will need to go online to our website at health.pa.gov and register for an appointment time. You will then need to bring the email confirmation of your appointment with you to the site. When you travel to the site, you will be directed from the highway to the parking lot of the arena. You will stay in your car. A sample will be collected, and you will then be directed back onto the highway to return home to self-isolate while you are waiting the results of the test. The state laboratory in Exton will be processing these tests, and we will be providing results in 2 to 3 days. So remember, after you are tested, you must go home and stay home in isolation. And please take care of yourself. Remember, you were tested because you have symptoms of COVID-19. So you need to make sure that you get plenty of rest and you stay hydrated, that you keep eating, and then if you have a fever, to take acetaminophen. Please stay in touch with your doctor or other healthcare provider. And if you experience a medical emergency, of course, please call 911. It is essential, and I want to emphasize this point, that you do not make any stops on the way to or from the testing site, such as a grocery store or a pharmacy. And please avoid public transportation, ride-sharing, or taxis. We are taking every precaution to safely provide this critical public health service and prevent the spread of COVID-19. Drive-through testing has been successful in many parts of the country and right here in Pennsylvania, including the Philadelphia and Montgomery County sites. And we know it will be successful here. I want to thank all of our teams from PEMA, the Pennsylvania Emergency Management Agency, the Pennsylvania National Guard, and of course our Department of Health, who have worked to find a location that was accessible to the entire Northeast region. This is a very important step as we continue to see a rise of cases throughout Northeast Pennsylvania. We are hopeful that the results will give us a better understanding of what is happening and how we can stop the further spread of COVID-19 in this region of Pennsylvania. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Please don't touch your face, especially after touching surfaces, and clean surfaces frequently. If you have to go out for life-sustaining activities, please wear a mask if you are going to come in contact with others. These everyday prevention measures are so important and can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Dr. Levine. From WFMZ, it's been said that the state can't begin the process of easing restrictions until there is ample testing available. What is being done to secure tests and other criteria needed to begin the process of reopening the state?
Well, we are working on all of those factors in terms of relaxing the social distancing and mitigation factors in certain areas of Pennsylvania as we proceed. And so you're correct. We will need to expand testing, especially in those areas where social distancing, particularly associated with businesses, would potentially be relaxed. These type of mass testing sites really offer a path forward, and so we're exploring really all ways to expand our testing, both our testing capacity at our Bureau of Laboratory for the Pennsylvania Department of Health in Exton, as well as working with hospital and healthcare systems in terms of their testing, in terms of the testing through LabCorp and Quest, and again, these mass testing sites. So we're looking to expand testing throughout Pennsylvania as much as possible.
WFMZ also asked, is this the state's job or Washington's?
Well, I think that it is the state's job to implement these measures. I think that it's very important for the federal government to be able to provide the supplies and resources that we need in order, for example, to do that testing. So really all of our ordering of reagents and chemicals, et cetera, are through the CDC. And so we are dependent upon them for much of our resources for these chemicals and reagents. And so they need to supply that to us, and then it's our job to come up with a plan to expand testing in Pennsylvania.
From News Talk 103 FM, though you have medical expertise, it is not in public health. Who are you consulting besides Drs. Fauci and Birx at the national level?
Well, so I'd like to highlight that we have fantastic epidemiologists and public health physicians and other public health professionals at the Pennsylvania Department of Health. One person who you've met in different press conferences is Dr. Sharon Watkins. She is our state epidemiologist, and she is also the president of CSTE, the Council of State and Territorial Epidemiologists. But her and her fantastic staff are working with us every day in terms of these public health measures. In addition, we do have many reach outs to fantastic academic centers in Pennsylvania. So one example would be the CHOP, or Children's Hospital of Philadelphia Data Lab, who we're consulting with, and I've mentioned consulting with the University of Pittsburgh School of Public Health, as well as Carnegie Mellon University. Now, you are correct. I'm a physician, but I've also been Physician General for 2.5 years, and now Secretary of Health for coming on 3 years, and I am also the President-elect of the National Association for State and Territorial Health Officials. So I really think that that within our department we have the expertise, as well as consultations with great academic centers throughout Pennsylvania.
From WNEP, a viewer says she went to a hospital ER about a month ago and was tested for COVID-19. However, because she was sent home instead of being admitted, the hospital held on to the test and never sent it to a lab. Is that a standard procedure, and will those tests ever be processed and the patients notified of the results?
Well, that would not be standard procedure. If she was seen in an emergency department but not found to have severe symptoms that would require hospitalization, but a test was performed, then I would expect that that test would be run. I think it would be important for her to reach out to that hospital to try to find out the results of the test. It would be possible to reach out to us if that was not successful, but if that test was run, she should have the results. I'm so glad, however, that she's well.
WFMZ also asked, some articles suggest that people are testing positive after treatment. Is it possible to be reinfected?
Well, treatment, again, is a relative thing. Really, there is no accepted specific treatment for COVID-19 as it is a novel coronavirus. There are investigational trials and clinical trials of a number of different treatments, including actually trials being conducted right here in Pennsylvania, particularly in Philadelphia, at Penn State, at Geisinger, as well as UPMC and Allegheny. So lots of different places where testing is being done to see which effective treatments would be. But after recovery from COVID-19, we have heard some reports, particularly out of South Korea, that they're retesting positive. So those are being repeated in the United States, and we're trying to see what that means. It could mean that they were reinfected, but it could also mean that they have DNA from the virus and still present in their system, in their nares and nose, etc. And since the test is testing for the DNA, maybe that's why it's positive, even though they don't have any active virus. So we don't know really what the implications of those studies are. They need to be analyzed and repeated.
From the Citizen's Voice, is there anything in addition to a prescription that people need to bring to the Wilkesboro testing site?
No, they need to come in a car, and they actually don't need a prescription. They need to register with us at the Pennsylvania Department of Health website and bring their appointment time. So because it's a mass testing site at the Mohegan Sun Arena parking lot, then they actually don't need a prescription from a healthcare provider to have the test. That's the nature of how we do things at these mass testing sites.
From the Citizen's Voice also, will there be any travel restrictions in the Mohegan Sun area?
There will be, in terms of travel restrictions, I mean, there will be officers that will and personnel that will direct the traffic to where the tests are being done, and then direct the traffic right back onto the highway. And so we don't want people stopping, as I mentioned, and doing any shopping or anything like that. We want them to come to the site and then go right home.
From WNEP, an antiviral drug called remdesivir is showing some promise as a treatment for COVID-19 patients. Hershey Med is among the hospitals taking part in a new clinical trial. Could you talk a little bit about how this drug works and how long it may take to know if it is in fact an effective treatment?
So we have seen those reports, and there are a number of different positive reports about this medication being an effective treatment for patients with COVID-19 at Penn State and in other institutions. This is a medication that was devised to treat Ebola, actually, after the Ebola outbreak of 2014 in West Africa. But it has shown some promise. Now, those clinical trials need to continue on this medication, and this is really being used for the most ill patients that are in the hospital. This would not be a preventative medicine in any way. This would not be a medicine for patients who are just mildly ill at home. This would be for the sickest patients in the hospital, intensive care unit, etc. But we're really very pleased it's shown promise, but it's not definitive yet, and more studies need to be done.
From Radio PA, what is the difference between the test for exposure to COVID-19 and the test for antibodies to the virus? And which do you recommend for someone without symptoms?
Well, we're not at the moment testing anyone without symptoms. In the future, I think it would be useful to do viral testing and perhaps even antibody testing from a population point of view, but we're not able to do that. So it's only symptomatic people that are being tested. The tests that we are doing are a test for the virus itself. It tests for the DNA of the virus. Antibody testing, that's serology testing, is for your immune response to the virus. And there are a number of tests that have been released really mostly in the last week or so. We're looking at those tests to see what the value would be from a public health perspective. But those are not being used to make a diagnosis. To make a diagnosis that someone has COVID-19, we're using the viral test from nasal samples.
From WJAC, Dr. Levine, you had said that county-by-county negative test data was not useful from a public health perspective. What changed over the past few weeks now that you're releasing the data?
Well, previously, we were in a containment phase. In the containment phase, we were seeing isolated cases of COVID-19. We were doing extensive investigations about how those people were exposed and contracted COVID-19. For example, travel internationally, or perhaps travel to other areas of the United States, and then we would do contact tracing of those individuals, and so and then doing appropriate isolation and quarantine. We are now very far into a mitigation phase of this with 30,000 cases or more, and so the public health value of negative tests is larger now because we want to know where tests are positive and where tests are negative, and then of course, in the spirit of transparency, we want to put out that data for the public and the media.
From the Daily Press, are there any plans to make the data available to the public regarding how many of the confirmed cases of COVID-19 in each county have been known to recover? And is that a true number of confirmed current or active cases might be in addition to the cumulative case totals?
Well, so we are not able to track recovery of the 30,000 patients or more with COVID-19 in Pennsylvania. No state is able to do that. And so we will want to track the recovery from patients in the hospital. And we're working with an organization called PHC4 to get that data, the hospital discharge data. But we're not going to be able to track recovery of, again, over 30,000 patients. In the future, when these antibody tests are available, the serology tests are readily available, then it would be useful to see who has antibodies to COVID-19. But there's still a lot to learn about these antibody tests and the significance of having antibodies, how powerful those antibodies are against the virus, and how long they last.
From the morning call, with the Lehigh Valley experiencing a relatively high number of positive cases, has there been any discussion about opening a mass testing site in Lehigh or Northampton counties?
Well, the decision was made that, to place the mass testing site at the Mohegan Sun Arena parking lot because of easy access going in and out and easy access from throughout northeast Pennsylvania. And so, as we had said, that's going to have a soft opening on Monday and then open further. Now, as that site is going, we're going to be looking at lots of other possibilities for mass testing sites, but this one opens first.
From WNEP, one criteria for starting to reopen would be a consistent decline in the number of new cases over a sustained period of time. So far, we have not seen that in Pennsylvania. Do you believe that PA is close to the peak, and given the current lack of widespread testing, can we be sure that any subsequent and sustained decline in reported cases is an accurate indicator that it's safe to start reopening?
Well, we have lots of indicators that we're looking at in terms of positive and negative tests and where they are and the percentage of tests that are positive. But as I've stated before, this is not going to be one grand reopening of Pennsylvania. It'll have to be either county or regionally based, and we'll need to see those type of trends in those regions, and we'll need to make sure that we do have the testing and the public health workforce and policies and procedures available as we do that type of relaxation of social distancing in specific areas. But to repeat, it is not going to be statewide.
From KYW, from a health perspective, what reaction do you have to people who say that they are going to protest at the Pennsylvania Capitol on Monday to get the state to reopen?
Well, of course, in the United States and in Pennsylvania, people have the right to protest. But I have significant concerns depending upon how that happens. If those people do not practice social distancing, if they are not in their cars, they don't stay in their cars, if they come out and they're congregating together in a large crowd, of course, with a global pandemic of a respiratory virus like COVID-19, that could facilitate the spread, and I would actually worry very much about the health of those people.
From WBRE, are nursing homes required to notify county coroners and the Department of Health when residents die from COVID-19?
They're required to contact the Department of Health if someone dies of COVID-19, and we very much value the participation of coroners in the investigation of cases and are working on really good collaborative relationships with our coroners.
From Fox 29, Johns Hopkins University researchers who have been tallying the global pandemic reported yesterday that Pennsylvania's number of coronavirus-related deaths was at 921. However, the Pennsylvania Department of Health page doesn't reflect that. There are some reports that this may be a result of a computer glitch on the Department of Health page. Can you comment or explain further on why we're seeing two different numbers?
Well, so we are continuing to work to reconcile all our data, including our death data. We work with hospitals and health systems and physicians, other healthcare providers, long-term care living facilities, our coroners, to reconcile that data. We have very close associations and support with the Philadelphia Health Department and the Allegheny County Health Department, among all the other county municipal health departments. Again, I speak with Dr. Farley and Dr. Bogan every day, and they're doing an absolutely fantastic job. Now, remember that our reporting time is 12 midnight, and so depending upon when Johns Hopkins collects its data, there's bound to be some differences. And so we're working, again, to reconcile and perfect our data all the time.
From WESB, there are a lot of people calling for our area to reopen because of relatively low number of cases in McKean County and our surrounding counties. Yet we're also hearing reports that the number of cases is being undercounted because of lack of tests. What's being done to get tests to remote rural areas like ours?
So I think that there are a number of reasons why there are less cases in very rural areas. I think the main reason is that there's much less population density. Clearly, COVID-19, which is spread person to person as a respiratory virus through coughs and sneezes and respiratory droplets, is spread more in population-dense areas. We have seen this throughout the world. We have certainly seen this in the United States. New York City, I believe, has the highest population density of anywhere in the country, and it's not surprising that New York City would have the highest number of cases. And that is one of the main explanations why Philadelphia and other counties in the southeast, the suburban counties, also have the highest number of cases in Pennsylvania, and why certain cities in the northeast have those number of cases. places. But we also want to make sure that we have testing capabilities throughout Pennsylvania, including in rural areas, and we'll be working with hospitals, health systems, and healthcare providers to improve that, as well as selected mass testing sites in a sequential way.
From PBS 39, how does someone register to be tested at the new Mohegan Sun Arena site if they don't have access to the internet or website?
That's a really good question, and I'm going to have to check on that answer to make sure that people who don't have access to the internet can register.
And then as a follow-up, they're also asking, why are there disparities between what the state is reporting for county deaths and what counties are reporting themselves? Northampton County reported 30 deaths via the coroner's office on Wednesday. The state reported 25 that day. Yesterday, the county reported 34, including 3 people who resided in other counties or states. Yet the state's figures yesterday recorded 27 in Northampton County.
Well, so we do not report as a county death or even a Pennsylvania death someone who resides in another state. The way the CDC counts that is that if someone is a resident of another state, say it was New York or New Jersey, but they passed away potentially at, say, a hospital or a nursing home in Pennsylvania, actually that gets counted towards that state. That's how the CDC calculates its data, so that's how we calculate its data. So that could explain some of the discrepancies that we've discussed. In addition, there's a difference in terms of the time of reporting, but we're pleased to reach out to the coroner's office and to try to reconcile that data.
From NBC 10, do you know of any nursing homes in the state that are being assisted by the National Guard, and what is the National Guard's role?
So there are several nursing homes that are being assisted by the National Guard, and that's the medical support arm of the National Guard, and they're working to help provide care to patients in those nursing homes and to help them with their infection control procedures.
From KYW, what do we know about COVID-19 immunity, and can people get reinfected if the state opens up for business too soon?
Well, that's why we're not going to have a grand opening. We're going to go in a very slow, careful, progressive fashion in terms of relaxing any social distancing measures, particularly in terms of businesses and the economy. But it raises a good question. I had mentioned that previously, but to repeat, we need to know a lot more about immunity to COVID-19. As I've mentioned in the past, this is a novel coronavirus, which means a new coronavirus. We're still learning things every day about the virus and about how people respond to that virus. So clearly people have an immune response. They do produce antibodies, and we can measure those antibodies. What still needs to be definitively proven through science and through investigation is how powerful those antibodies are, how much immune protection they offer, and then how long do they stay in a person's body. So all of that is being investigated currently.
Also from KYW, the president has put the responsibility of testing on the states. Is that a responsibility that could reasonably undertake without federal help? How likely is that testing will become widely available, and how long will it take to get all of the necessary tests in order to begin safely reopening the state for business?
Well, as I've mentioned previously, we're working to expand testing throughout Pennsylvania. That includes testing through our state laboratory. That includes testing through hospitals and health systems and their laboratories. It includes testing that go to the commercial laboratories. And now mass testing sites in Montgomery, and now one opening in the Northeast with further expansions discussed. But we do depend on the federal government for much of the resources, particularly the reagents and the chemicals, to be able to do those tests. And so it has to be a collaboration, and we're looking forward to further collaboration with the federal government to expand testing.
From the Philadelphia Inquirer, the state is reporting far fewer deaths in Philadelphia than the city itself is reporting. Can you explain the discrepancy, and is there an issue like this with other counties?
Well, as I mentioned, we're working to make sure that we reconcile all data discrepancies. So we have a great relationship with the Philadelphia Department of Health and Dr. Farley. They do an absolutely fantastic job. We do report. I know we report our data at different times, and sometimes that can indicate a difference. But whenever there is a discrepancy, we will work together and collaborate to reconcile those discrepancies.
The Philadelphia Inquirer also asks, are there individual hospitals in the state that are at or near capacity of regular beds or ICU beds, and is the state tracking that?
So we do track that very carefully, and there are some hospitals which are challenged in Philadelphia and in the southeast, and so we're tracking their hospital capacity, how many beds they have, how many ICU beds they have, etc. And we're watching that more than every day. We're watching that as close to real-time basis as we possibly can. We will collaborate with those county municipal health departments and the hospitals. We want to make sure that they have enough beds, that they have adequate staffing, that they have adequate supplies such as the N95 masks and other supplies and ventilators. Ventilators we really seem to be doing very well on. If a hospital is getting to capacity, then we'll need to work to see if patients need to be transferred depending upon what is necessary. And then there is an alternative care site that is set up that could take patients now at Temple if Philadelphia itself is being challenged.
Our last question is coming from several different outlets, including the PLS Reporter and News Talk 104.1. Will the modeling tool Governor Wolf outlined yesterday, will it be available to the public? And as a follow-up, what thresholds are you looking for in each county for them to reopen?
So this would be an internal modeling that we're working with our academic partners on, so it would not be public-facing, and we're going to be looking at a number of different parameters, both public health parameters, but then other social and economic parameters to decide which counties would be best to relax social distancing and have some businesses open for economic recovery, and then how we're going to track that from a public health perspective to make sure that there are no outbreaks. So it's going to be a really great collaboration.
Thank you, Secretary. That concludes our briefing today. There will be no briefing tomorrow on Sunday. However, we will return on Monday with our regularly scheduled briefings. Thank you so much.